I'll give you a short historical background to why we are here today, and that is that some 15 years ago, or more than 15 years ago, I met with Dr. Neil Meredith at the Eastman Dental Institute in London. We were doing a basic course on implants, and he showed me his new invention, which was a device for measuring implant stability based on resonance frequency analysis. And I thought that was very, very interesting. So and also Neil showed me some in vitro studies that he had made together with Peter Cawley, who was a professor of vibration engineering in London and still is, and also Dr. David Elaine, who is a PhD in vibration engineering. And we agreed after another few meetings in Gothenburg with Thomas Albrechtsson and other people that we should continue to do some in vivo studies as well. So we decided that it was a good time for Neil to come over to Gothenburg. And when in Gothenburg, we started to do animal research, but also some clinical research at the Bronnmar Clinic, and where Professor Bertil Friberg was very much involved, and this resulted in a number of publications. Eventually, Neil presented his second PhD. He already had one from London, and in 1997 he presented his second PhD on the RFA technique. The same year, we also got a major grant from the European Commission to run a so-called demonstration project. And this kind of money you get if you have an idea which may become a commercial product. So the aim of this project was to test the technique, and we did that in a multi-center study involving clinics in Spain, in Italy, in London, and in Gothenburg. And the second aim of this grant was also to form a company, and that company is today Osstell AB, and before it was Integration Diagnostics. So the technique has actually been commercially available for quite a while. And also we have seen some lovely development of this technique. So today it's it's a wireless technique. And, you know, we're using the smart peg, and also Anders Petersen and his group has developed also that technique further on. So this morning, what we will do is to discuss, you know, what should we do with the technique? How can we use it in daily practice? There are some 150 studies published using the technique or evaluating the technique in the literature, but we don't have today any strong guidelines when it comes to the everyday patient. You know, how can we use the technique, and what should we do? So what we have done here is to invite three great speakers. We have Dr. Marco De Gidi from Bologna, Italy. We have Dr. Michael Bornstein from Switzerland, and we have Dr. Peter Moy from the US. And they will, during 15-20 minutes, discuss how they look upon this technique and how they use it in their daily clinical work. There will be no time for questions after this presentation, so I ask the speakers to make answers to three questions within the lectures or after lectures, or maybe not at all, we will see. And the first question is, if we are so successful with implant dentistry, why should we use ISQ measurements? And the second question is, at what ISQ level do you feel comfortable to leave an implant after surgery? And the third question is, do you think there is an ISQ level above which it's secure to apply immediate loading protocols to an implant?